Hi friends, welcome to Charcos. I'm Dr. Seema Balian, the founder and director of Charcos. Charcos is a healthcare recruitment and training company with over 15 years of experience in providing turnkey solution for training and recruitment needs for the nurses, doctors, and AHPs such as radiographers, occupational therapists, ODPs, and many more. OSCE training for all fields of nursing such as adult nursing, mental health nursing, pediatric nurses, midwifery, and learning disabilities. OSCE training is available in India as well as in UK. Orientation for life in UK, OSCE exam bookings and the logistics bookings, excellent pastoral care. Our state-of-the-art learning platform includes reading materials, videos, quiz to enhance your learning and equip you for a positive and a better outcome. For more information, please visit our website www.charcosglobal.com. Our Facebook page, Instagram, and LinkedIn pages by the name of Charcos Global, and subscribe our YouTube channel. Press the bell icon for regular updates and all the information that you require. We are looking forward to seeing you on our site and being a partner in your enhanced journey. Thank you very much.
Midwifery OSCE planning. This is the second station in the APIE section. This is a silent station. In this station, you will need to use an SPAR technique to write down your care plan. You will be given 14 minutes to complete this station.
Okay, so can you see my screen?
Yeah.
Yes, please. Okay, great. So welcome back. So yesterday we did the assessment, and today we are going to be doing the rest of the three stations, which are the planning, implementation, and evaluation. Yeah. So out of that one, we'll do the planning first, or sometimes we say to write the care plan. Now, please tell me that what do you understand by a care plan, and also that why do we write a care plan? So Mercy, tell me that what is a care plan and why do we need a care plan? Why do we have to write it down?
All right, thank you, Doctor. My little knowledge about the care plan is the things you are going to identify through your history taking will help you plan the care for the patients, and the planning of care should be patient-centered. It should be individualized. Yeah. Like the things you identify through your history taking that you are going to use to plan the care for the patients.
Okay, so you are saying that the care plan is actually giving the plan of what care you are going to be providing to the patient based on the individual circumstances. Yeah?
Yes, please.
Okay. Anything else? Priscilla, do you want to add anything else to it?
No, basically the same. For me, I know it's a documentation that consists of the needs of a patient and the things to be done to support the patient's needs. That's what I can say too.
Okay. Okay, I think that both of you are right in the fact that the care plan basically is a document that once we have done the assessment of the patient, we write this document to that what is the best way to care for this person, making sure that we keep the best practices and the evidence-based practices in picture. And also, as you have said, that we are going to be planning an individualized care for that particular patient. Because although the diseases and the problems are almost similar, but the way you treat a patient to another patient might be slightly different because of the difference in the circumstances and the different, because of a different person actually. Yeah, so, but still, it is still going to be a standard care that you will be providing. So a care plan is a document which will guide you to give a standard evidence-based, individualized care to the patient. And also, very important thing is that it is also going to make sure that the continuity of care is maintained. Yeah. Now, imagine that you have seen a patient, and if you do not write a care plan, yeah, then after once you finished your shift and someone else comes in that shift, it is quite possible that they are going to be treating the patient according to what their understanding is. So the continuity of care might not be the same sort of thing which you were providing, because the other person is thinking something else. So this document is going to be acting like a guide to that once a care plan is made, that everyone sticks to the care plan and the care is provided according to how the care plan is. That whether it is you as the person or whether it is your colleague who is looking after this patient, so the care plan will guide everyone to give the same type of care. Okay. So this is what a care plan is, and this is why we write a care plan and what is the importance of the care plan. So now that what we have understood this one, let us just see according to the exam, it is going to be a silent station. And by that, I mean that you are not going to be, it is not like that you will be talking to a patient or anyone. It's you just have to sit and write your care plan after you have done the assessment. So this station is always going to follow your assessment station. You will get 14 minutes to write the care plan, and you will need to write a care plan using the S-bar technique. Both of you understand what is an S-bar technique?
Yeah.
Yes.
Yeah, so quickly tell me, what is an S-bar technique?
Situation, background, assessment, recommendation.
Absolutely. So it's a situation, background, assessment, and the recommendations. And you will be given a black pen to complete this station. You will be getting an A4 size sheet, and you can use either one or both the side of the sheet. So it is not necessary that you have to complete two sides of that sheet. It totally depends upon what is your case and how you are going to be writing and what is the type of handwriting and thing that you have. So because it is a written sort of thing, make sure that your handwriting is clear and legible, and do not try not to rewrite, overwrite, cross out, because that is not going to look very neat. And if you are going to be crossing out anything, just make sure that you put a single line to cross it out and a little initial on the top, so that the examiner can know that it is you who have crossed it out. Okay?
Okay.
So then we have already discussed this one, that what is a care plan. So it is a document that is going to provide you direction for an individualized patient care, and it will also take into account the patient's choices and beliefs, because a care plan is something which you mutually agree when you are making a care plan. Why do we write? So for the standardization, evidence-based, holistic care, and the continuity of care, which we have already discussed. Format also we have discussed that it will be written as an S-bar technique. And saying that what information do you need to write a care plan, then of course we will need to know the patient's history, which we already know by this time because we have assessed the patient and we have taken the complete history of the patient over there. We have also done the observations of the patient. So we have got all that information. And how it is going to be evaluated. So for just the exam purposes, it will be evaluated by the set criteria by the NMC. But generally in the real life, or when you are seeing the real patients, the evaluation of the care plan is going to happen as we go along, because sometime, depending upon the situations, we might need to modify the care plan as we go along.
Okay.
Okay, so now just a little bit of a detail on that how we are going to be writing the in the situation. So when we say situation, and maybe you yourself can tell me that what do you understand, that what do you think that you will write in the situation? Mercy, you can tell me what will you write under the situation?
To my little knowledge, I think situation will be in the form of what the patient is presenting, the complaints, because the complaints the patient is presenting, like as we write in our nurses notes, and also maybe the time the patient reported to the unit or to the facility. That is what I understand by it.
You're right. So in the situation is basically when you are just describing that what as it suggests that what exactly is the situation, what is the problem. So you are going to be saying that, okay, so and so person with this date of birth and this hospital number presented to the maternity unit today at around this time with the presenting complaint of so and so. Yeah, so this is basically is giving the context to your situation, that okay, what is the situation, who you are actually seeing, who is this care plan about, yeah, and why you have to write the care plan. Okay, so over there you are also going to be writing that, okay, this is a lady who is a gravida 2 para 1 and has been admitted because of the complaint of abdominal pain with PV bleeding or whatever is the presenting complaint. So in the situation, you are setting the scene that, okay, this is the scene of the care plan that you are writing. Yeah.
Okay.
Then we come to the background. Now, background is basically what is going to be supporting your current situation. That how, why, and what are the things which have led to this particular situation, and what are the other things that you need to know in order to handle this situation. So that is going to be in your background is going to be including your medical history, your obstetric history, which will be of the current pregnancy and your past pregnancies as well. It is going to include any other medical history, such as maybe you are someone suffering with hypertension or asthma, or maybe you have got some kind of allergies, or you are known to have COPD, any of these kind of things that are there, which are also you'll need to take into account when you are planning a care. Then any history of the medications that you are on, because those are also very, very important for us to know that what all the medication patient is taking, if they are allergic to anything. Also, if there is any relevant family history, if there is anything which social history or something we need to know about. Yeah, so all these histories are going to be making your background, which is supporting your situation and your current sort of problem, and that is going to give you that how you have to deal with the situation based on the bigger picture which the patient is presenting. Yeah. After that, we come to the assessment. And this is the assessment where what you have done, the findings of your assessment that you have just assessed the patient. So you are going to be putting your Muse score into that one with what is the review of time that you have set for the patient and why you have set that review time for the patient. So it might be that you are reviewing the patient every hour or every 30 minutes or every 15 minutes, depending upon what is the problem that the patient is having. And then is the recommendation. And in the recommendation section, you are going to be coming up with a working diagnosis, which is based upon your assessment and what are the primary problem which the patient have come up with. And then you are going to be giving a few recommendations or interventions which are required. For example, if say if the patient has come with the PV bleeding, then you might have to write down that, okay, that you will need to provide like a pad to the patient. You will need to check that how is the bleeding increasing, is there a pain also happening. So that every hourly you might have to do the observations. Every hourly you will need to see the patient. You will need to do all the assessments, observations you will need to take of the patient every hour. You will need to make sure that the patient is taking adequate rest. You will give the painkillers to the patient. You will also need to make sure that the fetal well-being is maintained. So all these things that you are going to be saying over there, they become your recommendations that based on the problem background and your current assessment, these are the steps that you are going to be taking in order to provide the best care to the patient. So have you understood this one, that how we will write the care plan for in the maternity sort of ward, or for the midwifery OSCE? It is slightly different than how we write a care plan for an adult or pediatrics or the mental health one. But then the problems over there are different, and the way to deal with them is also different. So, so any questions so far?
No.
So with
yeah.
Doc, please, with the background, as you stated, as you stated, we are going to write all the medical history, the social history, and everything. So that one, are you going to paraphrase what has been given to you, looking at their mock? Because with the mock, it's very lengthy, and you are going to use 40 minutes to write it. So are you going to paraphrase it, or you are
can
going to write
it.
everything?
No, you can paraphrase it. You are not required to write each and everything like it is there in the history. You can shorten it, you can paraphrase it, you can just write the relevant points out of it. Yeah, so you do not have to write the full story.
Okay.
Yeah.
Thank you.
Okay, no problems at all. So now, since the problems that what we are having, because they are also depending upon that our case scenarios are different. So if we are going to be writing, like say, for example, if you're writing a care plan for the antenatal patient, then we can see that to identify the main issues of the patient. So that is like either it is going to be a rupture of membrane, or either the patient is coming with abdominal pain. They might be coming from the PV bleeding. So there can be various issues which the patient might be coming, and that is how you are going to be writing their history depending upon that. And the same way, if the patient is in labor or in imminent birth, if they are going to go, then also you are going to be writing the same sort of pattern, the S-bar way, that you will include what is the current situation of the patient, what is the progress of labor, what is whether the membranes have ruptured or not. In the background, again, the similar kind of things, the medical obstetric history, past medical history and things. And the assessment, you are going to write your findings as per your partogram. And again, in the recommendation, you are going to be recommending that depending upon your partogram, the progress of labor, what are the NICE guidelines, the stages of labor which are there. Apart from the stages of labor, the other things are always going to be like considering the comfort of the patient, involve the patient in the care and decisions. So now this is fairly important, because when we are writing a care plan, and especially like in the midwifery, because it's a very, very personal sort of choice and personal things of people, and a very emotional situation which is there. So it is very important that we make sure to take care of the patient's decisions, the patient's choices, and how do they want to progress. And at every stage, we need to get the patient involved, that what exactly is happening, giving them the updates and things. And of course, it is very, very important to also in your recommendation to mention that you are going to be clearly documenting the progress of labor and all of the other interventions which you are going to be putting in. Okay. So it's basically the same thing, but you have to put it in the context of what is the condition, whether it is an antenatal patient, whether it is in the labor, or whether it is a postnatal patient. But the template is going to stay the same.
Okay.
Okay, same in this one, postnatal one as well. So it is going to, template is going to stay the same, what you are going to be doing. A slight differences are like that. Okay, in the postnatal recommendations, you are going to be also including like the breast care, the perineal care, the breastfeeding. You are going to include those things as well, because the situation has changed a little bit. Now, these have also come in picture, which were not there for the antenatal or for the labor one. Now, this is just an example of how now, this is not like a for care plan which is written, but if you see that how the criteria is based, and maybe that is going to help you understand it a little bit better. So, say for example, we have a scenario where this lady has presented with vaginal bleeding. Yeah, and she is like 38 weeks pregnant, and it's a second pregnancy, and the woman is reporting a small amount of fresh blood loss vaginally as well as abdominal pain, and she looks in pain as well on admission. Yeah. So when we do an assessment of this patient, and then we are going to be writing the planning for this patient. So if we see that how when they are marking that what is the examiner thinking that what you should be writing. So you should logically and accurately provide the detail of the current situation. And now in the current situation, because we know that she is coming of vaginal bleeding, so we should have already thought about that whether this is a post-coital bleeding, if there is a fresh red blood loss on wiping only, is there an active bleeding, no active bleeding, and the pain, whether it is an intermittent abdominal pain or whether it is a contraction-like pain, whether the pain happened once and now it is not there. So these, we should logically think that, okay, what might be the reason for this PV bleeding which is there. Then we are accurately providing all of the relevant and medical and obstetric history of allergies and things. So now in this one, this is the history which you might have, that there was a sexual intercourse in the morning and intermittent abdominal pain since then and a small blood loss since then. Yeah, so it is almost saying that it looks like that it is a post-coital bleeding rather than any other reason. So with just the history, you are able to figure out that what is the most logical reason for this bleeding. Yeah, so that is why history is very, very important. And after that, you provide details of your assessment, that how much was the bleeding, what was the type of the abdominal pain, whether the uterus or the tummy is soft, whether it is non-tender, whether there was any active bleeding at that time or not. And then you are giving the meow score and all those things as well. And the fetal observations, you are writing those as well, so that everything is reassuring in that one. And then you give your recommendations that, okay, that a medical review is required. Now, Kleihau test is required. Now, what is a Kleihau test and why do you do it?
Please, the test again.
Yeah, so this one, the Kleihau, this test.
I'm not seeing it.
It is used to check fetal maternal hemorrhage.
Yeah.
Whether the mother and the fetal blood has mixed or.
In what situation it is going to be important?
Oh, I'm coming.
Labor or.
Now, see, normally it is not a problem, but when can this be a problem?
Please, I'm not seeing the test you talk about.
Yeah, so I had, remember that when the topics which I gave you to read, I had mentioned this test over there as well. See, as Priscilla has said, that this is a test which we do to actually figure out that whether this bleeding which is there, like whether it has something to do with the fetal-maternal mixing of the blood, and which might be the hemorrhage because of this reason, and whether it is coming from the baby, this hemorrhage. Now, the most important time or when it becomes very, very relevant is if the mother is Rh negative. Yeah, so when you have to give an entity and all those things, because that is the time when you do not want the mother and baby blood to be mixed, because if the baby's blood group is different, then that can lead to the fetal hemorrhage. So if there is a bleeding, which is there. If the mother is coming from, or if there is a PV bleeding that they are coming, then we must do this test to rule those things out. Yeah, do you understand that, Mercy?
Yes, please.
Yeah. So coming back to the recommendation. So the recommendations that you are going to give is that obviously the lady is going to require the review, the blood test, you might have to do some midstream urine sampling. You might also need to, depending upon what type of bleeding and all that is there, you will also start the meows chart. According to that, you are going to say that what should be the time for the assessment, and you are going to be making sure that you say the call bell and all those things will be given to the patient. The patient will need to be aware what to look out for if she's going to the toilet, that whether the bleeding is increasing, to use the pad and all that thing as well to check that whether what is the bleeding, whether it is getting worse or whether it has stopped. Yeah. And of course, to write clearly and legibly, and your sign as well over there.
Okay.
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 Yeah, so basically, this is the main gist of your care plan. So it's not like a very big sort of thing that you need to learn as such in this one, because this is more of whatever assessment that you have done. Majority of that is writing the same sort of assessment in your own words. And then the main thing that you need to remember over here is that what are the logical recommendations that what you are going to be giving, which of course are going to depend upon your scenario. And if you are able to write around 4 or 5 recommendations which are relevant and which are the most important one, it should be fine. So when you have got 14 minutes, I think 14 minutes is more than enough for you to write this one, because it's only one thing, one page or maybe 1.5 page that you will end up writing. Yeah, so common mistake is that if you do not have a clear-cut format that you are following, like in an S-bar thing, so if it is very muddled up and thing, so it's always a good idea to form clear paragraphs. That okay, you form a situation paragraph, you form a paragraph for your background, a paragraph for your assessment, and then your recommendation. So it is very clear that you are writing the care plan according to the S-bar. If you don't give any the complete information, especially like if things like allergies and all those things which are important, then also it can become difficult. If you run out of time and you have not been able to complete it, if the handwriting is illegible, that people can't read what it is, and if the recommendations are not per as evidence-based medicine, or if you are using too many abbreviations which are not understood, which are not common abbreviations. So these are some of the things to make sure that you avoid doing. And again, the tips are just to make sure that you have read and you have understood the scenario. Keep your care plan simple and to the point. So try not to make it like too good and include too many details into that, because then you might lose the plot in that just to keep it simple and relevant, that this is what it is. And if you are using any of the tools, so it is important that you highlight that what all are the tools that you will be using for a particular things. Like say, if you say that you are going to be assessing the patient every hour, then you must write that you will be assessing the patient every hour using the meows tool. Yeah, so that we know that that is the tool that you are going to be using. Or saying that you will be assessing the patient's pain score using the pain score tool. So you can use that one. Yeah, and of course, to remember to sign and date it, because that is again very common mistake that people make. And until and unless you have signed it, and it is not going to become relevant. So please make sure that you do that. And of course, to complete the care plan in 14 minutes. So whoever I have spoken to, no one has really come back saying that they were not able to finish it in 14 minutes. So I think 14 minutes is a good time, and you should be able to complete it. Yeah, so basically this is what your care plan is. Now, do you have any questions in this one?